Welcome to the North Dakota Center for Nursing's presentation, SAGE, Roles of the Preceptor. This continuing nursing education program was created by Becky Grainer, MSRN, Patricia Moulton, PhD, and members of the Preceptor Development Committee. The purpose for this presentation is to provide an overview of theories, frameworks, key concepts, and principles that influence the knowledge, skills, abilities, and judgment for mastering the role of preceptor. The objectives for this presentation are review roles and expectations of the preceptor, review common theories, concepts, and frameworks related to teaching and learning, and review standards and principles related to becoming a nurse preceptor. This overview will focus on the advanced practice registered nurse serving as a preceptor. This overview is for those who have some background knowledge in the principles of teaching and learning and in nursing education activity development. Throughout the presentation, you will see the key symbol. The symbol alerts the learner of key material that is essential for mastering the role of the preceptor. You will be alerted of the availability of further information when you see this star icon. You are encouraged to explore these links. To obtain a certificate of successful completion for this learning activity and earn contact hours, you will need to complete this self-learning module, follow the extra learning links provided throughout the program, and complete the evaluation form. So let's get started. Preceptors facilitate the integration of theory and practice with the learner while keeping patients safe. Theory application through evidence-based nursing actions is the foundation for practice. In discussing your role as a preceptor, the review of theories, concepts, standards, and principles is necessary to build a shared framework and language in this area of nursing practice. Nursing education shares a set of theories, concepts, and principles that overlap with other professions such as education, human development, psychology, sociology, and instructional design. We will briefly touch on some of these theories and frameworks throughout this presentation. The acronym SAGE was developed as a method for easily remembering the key roles of the preceptor. So our four main roles are socializer, assessor, guardian, and educator. This concept map was developed to provide a visual depiction of the various roles expected of a preceptor. Evaluation of your performance can be based on this framework to help you assess areas where you can seek out and add learning activities to fill in any gaps you may uncover during your review of this material. We will start with the socializer role and its key components of relationship building and of being a role model. The preceptor makes introductions, assesses expectations, and helps the preceptee filter and respond appropriately to feedback. Actions such as introduces the preceptee to team and others, supports social needs, supports adjustments to new roles, fosters integration into workplace culture, helps establish communication between preceptee and management, helps resolve conflict should any arise, ensures support of colleagues for socialization and orientation purposes. As an example, the preceptor introduces the preceptee to work groups. The preceptor knows the organizational culture that the new person is coming into and facilitates a smooth onboarding experience. Many of the preceptees the APRN will precept have been RNs for some time. The preceptee brings a wealth of knowledge and experiences to the relationship. The transition to a new level of responsibility as an APRN is a key area the preceptor can focus on when helping the new person transition to their new role. Transition is a psychological process one goes through to come to terms with a new situation. It is not change. Change is a situation such as having a new boss, being on a new team, or functioning under a new policy. Change is external and transition is internal. Transition to a new role can be very stressful. Assisting the preceptee in managing stress, developing coping skills is very important. As a preceptor for APRN students, it is important that you role model and help the future APRN in understanding their new level of practice. As you work with the preceptee, you can help them transition to their new role by clarifying the relationships between educational competencies, licensure, and certification. It will be critical to empower the APRN by helping them understand their scope of practice and their responsibilities to not only the patient but the profession as well. Helping them understand the language related to competencies, licensure, and certification will help them master their new role. You may want to share this slide's content with your preceptee. Take a few minutes to review the consensus model at the link provided on the slide. It is important that the preceptee understands their new role expectations and how they will be developing relationships with others based on their new role. You may pause now to explore these resources. For some, leaving one level of nursing practice or one area of nursing practice and learning a new specialty can be very stressful. Kubler-Ross has described this as the process of grieving. In stress management, this process has been called the death of unmet expectations, triggering a grieving response. Preceptors need to be aware of the impact the stress response has on the person's ability to learn. You may pause now to explore these resources. Next, we move to the role of assessor. We start with one of the most important concepts, patient safety. To ensure patient safety, the preceptor will constantly wear the hat of evaluator, providing feedback to the preceptee, validating performance, and correcting where necessary. It is critical that the preceptor becomes familiar and comfortable with his or her role as an evaluator. To evaluate, you must know the competencies the preceptee is expected to meet. It is essential to clearly outline performance expectations and to understand the methods and criteria used for performance evaluation. Evaluation in education is the appraisal of progress or lack of progress the student has achieved in their quest to reach set goals. Evaluations can be done by the self, the preceptor, the faculty, the patient family. Advanced practice nursing students often co-create learning goals with a variety of others as well. Evaluation is Standard 6 in ANA's Standard of Professional Nursing Practice. Evaluation in this context is the appraisal of nursing process and actions in relation to patient, family, community outcomes. There are a number of models that can be used to structure evaluations. Results of evaluations are used to improve performance, improve outcomes, and to change processes. To measure or evaluate, one must know the expected competencies linked to the standards of practice and performance for the APRN. We will talk more about competencies in just a few minutes, but first we continue with the topic of evaluation. As earlier stated, preceptors must be comfortable with the process of evaluation. The process includes a variety of aspects that include who, what, where, how, and when. This also involves the use and/or development of skills such as emotional intelligence, communication, and coaching. So let's briefly go over who, what, where, how, and when of evaluations. Who does the evaluations? Faculty, preceptors, preceptees, peers, families, patients. What do evaluations use to measure? Competencies. Where does an evaluation happen? In action. If appropriate, reflection and action can occur during patient care. After action is reflection on action after the patient care has been concluded. How is it accomplished? By gap analysis, through formal written feedback, by discussion, through testing, and by reflection by the preceptee. When does it happen? Formative evaluation occurs during the feedback process. Examples are feedback, modifying instructions, or clarifying. Summative evaluation is assessment of learning at the end of a set period. Examples are final exams, projects, or papers. You'll be hearing the phrase knowledge, skills, abilities, and judgment. ANA provides an easy-to-remember explanation in the second edition of Nursing Scope and Standards of Practice, published in 2010. So what does this phrase mean? Knowledge attributes are thinking, understanding of science and humanities, professional standards of practice, insight gained from context, practical experiences, personal capabilities, and leadership performance. Skills are things such as psychomotor, communication, interpersonal, and diagnostic skills. Ability attributes are capacity to act efficiently, which requires listening, integrity, knowledge of one's strengths and weaknesses, positive self-regard, emotional intelligence, and openness to feedback, and judgment, critical thinking, problem-solving, ethical reasoning, decision-making skills. Now we come back to the definition of the terminology competencies. Competencies are an expected and measurable level of nursing performance that integrates knowledge, skills, abilities, and judgment based on established scientific knowledge and expectations for nursing practice. As you can see, competencies are not merely a laundry list of skills. Rather, they include a wide range of expectations that include both knowing and doing. Competencies are fluid and dependent upon work setting, patient needs, and provider education level. Commonly known competencies in nursing are those defined by the Institute of Medicine and Quality and Safety in Education for Nurses, or QSEN. For further information, click on the link provided in the slide. Standards of practice are defined by ANA and specialty organizations. The ANA standards list competencies all nurses are expected to meet. We will talk more about standards of practice and performance later. QSEN uses similar frameworks, but splits out the quality improvement and patient safety, whereas Institute of Medicine lumps those two categories into one under quality improvement. There are many models that list and define competencies, and there are many models for organizing evaluation. COPA is one well-known model. Preceptors should ask the academic institution how they organize their evaluation method. COPA stands for Competence, Outcomes, Performance, and Assessment. Lenberg's 8 core practice competencies with sub-skill examples, or the COPA model, is available at the link provided on the slide. You can read an article that provides an overview of the COPA model if you are not familiar with it. Competencies measure skills and behaviors. Another way to view competencies is presented by the American Association of Colleges of Nursing, or AACN. They have formulated what are called collaboration competencies. Because the APRN practices collaboratively with so many different disciplines, understanding the competencies to grow and maintain these relationships is essential. The preceptor is expected to role model and mentor the new practitioner so he or she will achieve and maintain these competencies. To learn more, click on the link on the slide. Another role of the preceptor as assessor is to facilitate growth and sophistication in critical thinking and reasoning. A framework provides the preceptor a guide to use with the learner that fosters thinking, reasoning, and clinical judgment. Tanner's model provides a reliable framework in which to help the preceptee develop clinical judgment. This slide depicts a visual representation of the model. It shows the relationships among the different concepts. At each point in the model, the preceptor has the opportunity to improve the learner's ability to build clinical judgment. Tanner's model helps the learner by establishing a shared language and a way to organize or label one's actions. Tanner's integrated model of clinical judgment contains the ideas of noticing, which is the grasp of the situation at hand, interpreting, developing sufficient understanding of the situation to respond, responding, deciding on a course of action deemed appropriate for the situation, which may include no immediate action, and reflecting, attending to the patient's responses to the nursing action, which in the process of acting, reflecting in action, and/or reflection on action. We provide you these resources if you want to learn more about Tanner's model. You will need to access them through your local library or an online service. Next, we explore the role of protector or guardian, another key role the preceptor plays. Boyer describes the preceptor role of guardian as one who provides the learner with a safe environment in which to learn while keeping the patient and family safe. It is a blending of evaluator, coach, and protector. In this role, the preceptor protects the patient and family from novice error, protects the preceptee from making errors that might threaten their self and future, provides a safe learning environment for the preceptee to learn and practice, supports developing skills, ensures adherence to policy and procedures, considers licensed scope of practice when assigning and delegating, protects the preceptee from adverse behaviors of others, and assists the preceptee to cope with stress. Advocacy is the basic action of nursing. Preceptors as guardians are expected to be an advocate for the preceptee. The codes of ethics for nursing guide your behavior not only in relationships to patients and families, but with your colleagues as well. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human responses, and advocacy in the care of individuals, families, and communities, and populations. To learn more, click on the links found on the slide. Last, we cover the role of educator, which requires an understanding of the concepts of teaching and learning and of evaluation. Your ability to provide feedback and coaching for desired outcomes is essential. Slide 38. The preceptor will need basic knowledge of adult learning principles, learning taxonomy, generational and experience considerations, learning teaching styles, and instructional design. In the next section, the presentation will cover these 5 topics. Andragogy, or adult learning, is a theory that holds a set of assumptions about how adults learn. Andragogy emphasizes the value of the process of learning. It uses approaches to learning that are problem-based and collaborative rather than didactic, and also emphasizes more equality between the teacher and learner. Another term you may hear is pedagogy, which means the art or profession of teaching, not to confuse it with andragogy. You may pause here and click on the link to learn more about the adult learning principles outlined by Knowles. Knowles specifically looked at what learners need to know, self-concept of the learner, prior experiences, readiness to learn, orientation to learning, and motivation to learn. Other common learning theories are transformative learning theory, social learning theory, and the hierarchy of needs, which should be very familiar to nurses because it's Maslow's hierarchy of needs. The preceptor will need a basic understanding of the theories of how we learn. Besides Knowles, there are 3 common theories that influence how we conceptualize adult learning. We view them through the lens of transformative learning theory, social learning theory, and hierarchy of needs theory. Learning taxonomies are a classification for information or mechanism that categorizes how things relate to each other. There are 2 taxonomies we would like to share with you. The next several slides review both Bloom's and Fink's taxonomies, and we provide you links to both so you can more fully explore these taxonomies. You may pause the presentation here and explore the links. Fink's taxonomy provides a well-rounded approach to teaching. He categorizes 6 areas where the learner can change. His work is based on adult learning principles. These areas are foundational knowledge, application, integration, human dimension, caring, and learning. For learning to occur, there must be some type of change in the learner. No change, no learning, according to Fink. Most of us have heard of Bloom's taxonomy. It is the language we often use to write objectives. Bloom's original work can still be found in many resources. However, his work has been revised and is being used in the revised format by many educational institutions. You will recognize the language in many of the objectives that are found in the preceptee's academic paperwork as connected to Bloom's taxonomy. To learn more about Bloom's, click on the link provided in the slide. Preceptors will need to consider the influence one's generation has on teaching and learning. The table provides a very brief synopsis of the generations you may interact with as a preceptor. These descriptions are general assumptions found in the different age groups. You are cautioned not to use them as labels, instead merely to inform you about the possible behaviors the preceptee may bring to the relationship. You may pause the presentation here to review the table. If you would like to learn more on the topic of generational differences, click on the link for further resources in the slide. Next, we will review learning styles. Learning styles are how an individual receives and processes information, how information is stored in the brain, and how that same information is retrieved and used. Kolb discusses areas of concrete experience, reflective observation, and active experimentation. A significant factor in learning styles is one's adult development level. Benner's theory is more specific and relates one's learning style to one's development level as a nurse. If you are not familiar with the various learning styles, please pause here and explore the links provided. In the additional resources section of this learning activity, there are a number of additional resources for your use. So you may be wondering, what kind of learner am I? VARK is a questionnaire that provides users with a profile of their learning preferences. There is also another tool called the Index of Learning Styles questionnaire. To determine your learning styles, take this quick online assessment. Pause here to complete the surveys. Next, we will define the terminology instructional design. Instructional design is the practice of creating instructional experiences which make the acquisition of knowledge and skill more efficient, effective, and appealing. The process consists of broadly determining the current state and needs of the learner, defining the end goal of instruction, and creating some intervention to assist in the transition. Ideally, the process is informed by the process of teaching and may take place in student-only, teacher-led, or community-based settings. There are many models, but common parts are analysis, design, development, implementation, and evaluation. In the educator role, you will both teach about our standards of practice and performance and socialize the preceptee to the new role and expectations and responsibilities. Some roles will be blended among all the roles you fill as preceptor. Each of ANA's standards lists competencies for the RN and additional competencies the graduate-prepared specialty nurse and the APRN must fulfill. Preceptors are expected to role model this professional behavior. If you have not already committed to being a preceptor or resource for your colleagues, we gently remind you that serving in this capacity is an expectation outlined in the Standards of Professional Performance. The preceptor role has grown into a formal, well-defined set of expectations. The roles of socializer, assessor, guardian, and educator assist the new nurse to transition to their new role and are critical components of being a preceptor. The preceptor will mentor the new APRN in understanding and practicing professionally. Take a few minutes and review the scope and standards of practice and performance and the North Dakota Standards of Practice. Click on the links provided on the slide. You have now reviewed the 4 areas of SAGE. So now what are your next steps? You will need to know several other things about being a preceptor. The facility and clinical site often have specific policies and procedures that potential preceptees will need to follow to gain access to the site. Academic institutions must follow specific rules set forth by a variety of accrediting agencies. Clinical sites and academic institutions will have contracts that must be in place before students can begin any clinical experience. Legal contracts need to be signed by the appropriate level of person or persons, and students must meet facility requirements to engage with the patients. Preceptors must be provided the individual academic institution's paperwork that clearly spells out student objectives, evaluations, and faculty contact info. Along with this information, the preceptor will need to be aware of the receiving clinic facility's requirements for students to practice in their organization, such as criminal background checks, HIPAA training, and CPR requirements. Preceptors will be expected to obtain and review the students' program goals and objectives. That material is provided by the specific educational institution. Many of these documents are shared via a dedicated website or electronically via email. When serving as a preceptor, always request a contact person who can be reached while the student is in the clinical setting should questions arise. In summary, being a preceptor is the art of creating an environment through conversation and a way of being that facilitates the process by which a person can move toward desired goals in a fulfilling manner. If you are interested in serving as a preceptor, sign up to be part of the North Dakota Center for Nursing's Preceptor Bureau. Follow the link to access the application form and see the North Dakota Center for Nursing's website for opportunities to serve as a preceptor. For further information, contact Patricia Moulton, the Executive Director at the North Dakota Center for Nursing. This concludes this educational activity. Please complete and submit your evaluation to receive your contact hours and certificate of completion.